Okay, guys, if you've been following me for any amount of time, you know anything that I put an asterisk next to, I underline, or I highlight, you are most likely going to see that on your exam. So I'm covering psych right now, the patient with hallucinations. Some very important things you guys need to know for testing. You need to watch out for cues such as them muttering to themselves, appearing distracted, suddenly stopping conversation as if they were interrupted. Assess for command hallucinations. Guys, command hallucinations, these are the most dangerous type of hallucinations because whatever that patient hears that voice telling them to do, they feel compelled to do it, which means if that voice is telling them to punch you dead in your throat, they feel compelled to do it. They cannot help themselves. So you better watch out for command hallucinations. Assess the patient for it. Avoid referring to the hallucinations as if they are real. This is a famous nursing test questions. You cannot say, what are the voices saying to you? Because when you ask them that question, you are giving validity to those voices that are not real. Your job as a nurse is to bring that patient back to reality. So instead of saying, what are the voices saying to you? Ask them, what are you hearing? And then when that patient tells you what they're hearing, you say to them that you do not hear anything. Why? You're bringing them back to reality. Focus on reality-based here and now. You want to guide that patient back to reality. Avoid overly loud or stressful places or activities. This is only going to make that patient more stressed and make them want to lash out. And you want to avoid that patient from becoming combative or violent. This, I put HESI next to it because it's a famous HESI questions. Use other sounds that compete with hallucinations. You have to teach that to the patients. Those patients who are hearing voices, you have to teach them. You start hearing those voices, start to read aloud, start to sing loudly, put on the radio and put it loud. You want something else to drown out those voices that the patient is hearing. You guys absolutely must know this for testing purposes.